And what I found was when you help people to live, heal their lives, find peace, whatever term you want to use, the byproduct was not dying. I have letters that end with, and this was a woman who was told she had 2 months to live and said, this time I agreed with my doctor because I felt so bad. And she bought a dog, put in a wildlife habitat, laughed more, took vitamins, did lots of things. And the letter ends with, I didn't die, now I'm so busy I'm killing myself. I told her to take a nap. But you see, again, the state of mind. That a gentleman in London, this was about a year ago, was told he had 2 months to live. He spent every penny to have a wonderful 2 months. And at the end of 2 months, he's feeling wonderful and wants to sue his doctor because now he doesn't have any money. And again, it's not, his doctor didn't make a mistake. Well, one of the things that impressed me was last summer, the Lockerbie killer, the man who blew up that plane, was allowed to go home. They said he has a few months to live. He has cancer. Now, we have not heard that he has died. See?
No.
And he was given a few months to live. So the Scottish, establishment, politicians said, okay, go home and die. And he isn't dead yet. And that's the power of the mind. Because let me start with two simple things. One was at a radiation therapy conference when the radiotherapist came up to me, an oncologist, radiation therapist, and he said he felt terrible. I said, why do you feel terrible? He said, we repaired our machine, and a month later when we did our routine inspection, we realized we hadn't put the radioactive material back in. I said, you don't really know what you're telling me. He said, what do you mean? I'm telling you how terrible I feel. I didn't treat anybody. I said, you'd have to be a total idiot to not realize you aren't treating anybody. So I said, you had tumor shrinking and side effects of radiation, obviously. And his eyes bulged. He said, oh my God, you're right. And that's how powerful I learned the mind was. I did a lot of children's surgery. And I call it deceiving people into health. Why? Because I'd say to a child, I'm taking you up to the operating room, you go to sleep and you go in the operating room. We get up the operating room, this kid flips over on his stomach and goes to sleep. And we get him in, I turn him over and he yells, what are you doing? I said, I'm turning you over so I can take your appendix out. He said, you told me I was going to sleep. And I sleep on my stomach. And I realized, he took it from the authority, that literally, that he went to sleep. And the anesthesiologist, who used to think I was a nut, began to realize, hey, this is impressive, what your words mean. And the other was talking to people asleep in coma and under anesthesia, that I would say to people, the surgery's over, you're going to wake up comfortable, thirsty, and hungry. And all my patients began to gain weight because I had said, you'll be hungry. And I didn't realize it until some came into the office complaining and said, it's my fault, because the nurse told them what I said to them while they were anesthetized. So I would simply add, you won't finish what's on your plate, the problem ended. But again, I realized when you're an authority, you are hypnotic. And so when I say deceive people into health, especially with kids, I say to the parents, and I wish I could deceive the parents, but I didn't want to get sued. So I would say, we're going to take vitamins and label it hair-growing pills, anti-nausea, pain pills, so you can give your kid as many as you need to. But you can literally say to them, oh, honey, don't worry, hair won't fall out. Dr. Siegel gave us these pills for you. And it was amazing how well the kids would do because of the faith they had in me and their parents. And I began ultimately to use even alcohol sponges to numb kids' skin because you take an alcohol sponge, say, I'm going to draw your blood, but don't worry, this will numb your skin. And a third of the kids would say, oh, thank you, why don't the other doctors do that? The others would still say it hurt, but it was a totally different reaction, if you know what I mean. It wasn't emotional, panic, oh, he's going to stick me with a knee. It was, hey, it still hurt. Okay, sorry, maybe it was a bad sponge. So you could go on and work with them. The other was, when you talk about ECAP, one of the patients, I went to a conference run by Carl Simonton back in the 70s with guided imagery and other things. And from the title of the conference, it was about helping cancer patients. I thought, okay, this is for doctors. 125 people, 2 psychotherapists and me. 122 were cancer patients. And I thought, what does this say about the community? That no doctor even shows up.
That's pretty bad.
But my patients were sitting with me, and the quote exactly was, she's sitting next to me. See, again, I realized I can't protect myself and be separated. She said, "You're a nice guy. I feel better when I'm in the office with you, but I can't take you home with me. So I need to know how to live between office visits." I thought, okay, I don't have to feel like a failure. See, I went into medicine because I like people, and then I couldn't cure everybody. And the other, even the emotional issues and spiritual issues. Why does God make a world with all these troubles? So, yeah, I did a lot of reading, trying to understand and be able to deal with it. But when she said, "You can help me live," I thought, okay, I don't have to feel like a failure anymore. Then the next lesson, you send out 100 letters to people with cancer saying, "You want to live a longer, better life, come to a meeting." I expect 300 to 500 people to show up. Of course, I forgot to put in the letter, this is only for the people who received the letter, from our office. And less than a dozen women appeared. And I realized, you don't have any idea what your patients are like, their will to live, their desires. But again, Biology of Belief by Bruce Lipton, if you're familiar with. His comment was, up to the age of 6, brainwave pattern is similar to that of somebody under hypnosis. But it goes beyond that too. Parents, teachers, clergy, doctors, we're all hypnotists. Not hypnotherapists, but hypnotists. So what we say to people destroys them. See? I used to ask people, because I grew up with love, I got along with God, and I did well in school. So I'm a minority group, see?
Yeah.
I didn't realize what troubles other people were having. And I would say at workshops, "What mottos do you live by?" You didn't ask us what mottos we're dying by. Quote, "My mother's words were eating away at me and maybe gave me cancer." Now you grow up, and see, she's not physically abused, as many were that I began to talk to, but psychologically. She was dressed in dark colors and told, "You're a disaster." She had to get cancer to buy a red dress, you see, and start a new life. And that, to me, is the key. That you have to be born again. And that has nothing to do with religion. But it also shows us why water is important in every religion. See, when you still your mind and you still your life, you can see your reflection. But if there's turbulence. Now, I was born an ugly duckling, and I mean this literally. My mother had medical problems, wasn't supposed to become pregnant, all kinds of hell, and she couldn't survive a cesarean section. So after many days, they finally said to her, "We got to get this kid out of there." So they pulled me out. And I didn't learn this till an adult. Because remember, when you're a kid and you look in the family album and you see a covered carriage, you assume you're sleeping, because your mother's smiling next to it. But what my mother said was, they didn't hand me a child, they handed me a purple melon. So we wrapped you in kerchiefs, put you in a carriage, covered it, and hid you behind the house so we wouldn't upset anybody. So I said to her, why am I not a drug addict or an alcoholic then? I mean, if I'm not touched. And she said, "Oh, my mother took you." That's why you're called the grandmother. Okay? Her mother took me, and this is a quote again, poured oil over your body and pushed everything back where it belonged 5 and 6 times a day. And I realized I must have felt like the most loved infant in the world.
Yeah.
Okay? Being massaged regularly. And we know the benefits of massage from the standpoint of brain development, weight gain, and a whole host of things. But the reason I bring that up is, you see, when you're reading the story of the Ugly Duckling, that kid impressed me because he's thrown out of the house, but he doesn't, as the other woman said, "My mother's words are eating away at me." He goes off on his own. He doesn't spend, his life saying, "That bastard, look what she did to me, and she threw me out." And he didn't have a grandmother, so he couldn't be rescued. But one day, he's sitting on a still pond, looks down, boom, I'm a swan. Yeah, you're right. Joseph Campbell, I came across this comment by him. He tells of a tiger who dies giving birth. She's chasing goats. The goats come back and say, why don't we raise the kid? And animals do that. I mean, really. I get sent so many YouTube things and other, of dogs raising squirrels and all kinds of craziness that goes on in shelters. But anyway, the tiger grows up thinking he's a goat. And one day, a tiger comes along chasing them, and he's sitting there. He doesn't know he's supposed to run away. So the tiger says, "What the hell's the matter with you? You're a tiger." And he goes, "Bah." Let me give you a piece of meat. No, I'm vegetarian. You know, Campbell adds a little sense of humor. But how does he show him who he is? He takes him to a still pond. And that's when Campbell goes on to say, it's like meditation, like yoga. You quiet your mind, and then you see you're a tiger. But he also said, it's okay, you don't want to scare the world by being a tiger. So it's okay to dress and look like a goat, but keep that tiger alive inside of you. And to me, again, as I said, that I learned from the patients how powerful the mind was too. Because these people began to be labeled one of Siegel's crazy patients. Why? You'd operate on somebody, and they would wake up, I mean major surgery, and the nurse would say, would you like pain medication? No, I'm not in pain, I'm just a little sore. So they would write, patient refuses medication. And I would say, why are you writing refuses? Well, they wouldn't take it. I said, ever occur to you they're not hurting? You see, because their view of surgery was so different. It was a way of being healed. And eventually the nurses began to get it. See, it's one of his crazy patients, so they'd write, does not require medication.